How can vascular surgeons have a future?
Well, it's interesting you should pose the question to vascular surgeons. And the answer must be that the future will be in the hands of the cardiovascular specialist. Vascular surgeons have driven the subject in the past. We've got to look to the future. And nobody says that only vascular surgeons will be performing vascular surgery in the future. We have interventional radiologists who have a stake. I'm proud also to be an honorary fellow of interventional radiology. The interventional cardiologists have a stake, and vascular surgeons themselves are not only performing open vascular surgery but endovascular techniques. So I think that the future has to embrace all of these specialties. Even cardiothoracic surgeons with less interventional work are retraining to learn catheter skills. And so what will vascular surgeons do? I think the question really is, what will all of us do to improve matters? And I think what we have to do is recognize that endovascular intervention is here to stay. Every patient will prefer to have a lesser procedure. It's all very well looking at costs, but patient preference is a very important issue. And patients prefer to have a procedure which has a small incision, is relatively painless, is patient-friendly, and when you have the randomized controlled trials of, for example, endovascular aneurysm repair, showing a superiority of EVAR against open repair, that makes it perfectly plain that endovascular aneurysm repair has a great future, and endovascular repair in many domains has a great future. So I think that the patients will drive it. All of the professions will also drive it, but in certain health economies, it will be necessary to look at the costs, not just in Scandinavia, Britain, and where there is a so-called socialized medicine, but the cost will become important. I've even heard that in the United States there will be a ceiling put on the amount that can be spent. And so the re-interventions after aneurysm repair or any endovascular procedure add to costs. And so I would say to the vascular surgeons of the future, the interventional radiologists, the cardiologists who are intervening, look to the re-interventions. The patient doesn't want to be a patient forever. The patient wants a procedure at low pain threshold without having to keep going back to the hospital. So that is my message for the future.
What do you like particularly about Datascope?
My inclination, and I'm extremely grateful to Datascope who are sponsoring this interview. I'm grateful that they have taken the 6th slot at the Charing Cross meeting, and we're very, very pleased to have Datascope as a major sponsor. We work very closely with the major sponsors, and we only have 6 major sponsors. And so we're pleased that Datascope are part of that.
What will happen on a political level? Will vascular surgeon societies end up merging with those of the interventional disciplines?
We will have a policy of opening the doors to all specialties. We will not say just vascular surgery or interventional radiology or cardiology. We will have the whole lot. But Charing Cross is not a society. The societies are very orientated towards a special discipline. I myself had much to do with the creation of the European Society for Vascular Surgery. But that was 1987. In 2007, 20 years later, would we have created the Society of Vascular Surgeons? No, perhaps it would have been a more mixed group of cardiovascular specialists. And so you're hearing from me that my personal responsibility and inclination is across the board. The standard has to be maintained to be at a high level. Vascular surgeons are, generally speaking, high level of competence and present well. And so, of course, being a vascular surgeon, I lean that way. But anyone who can be trained properly should do endovascular procedures.